Hello my beloved people, welcome back to my channel. Once again, I'm Endurance Soluka. Today we'll be discussing on cancer. Cancer is a group of disease involving abnormal growth with the potential to invade or spread to other parts of the body. These cells are teemed cancer cell, malignant cell, or tumor cell. This cell can infiltrate normal body tissue that the abnormal cell originated from. For example, breast cancer, lung cancer, colorectal cancer. When such damaged or unrepaired cells do not die, it becomes cancer cell. It shows uncontrolled division and growth. Cancer cell can break away from the original mass of cell which travel through the blood and the nerve system and launch in the other organs where they can repeat the uncontrolled growth cycle. The process is cancer cell, or the process of cancer cell leaving the area and growing in another body area is termed a metastatic cell or cancer. For example, the breast cancer cell spread to the bone. It means that the individual has a metastatic breast cancer to the bone. Types of cancer: we have bladder cancer, breast cancer, colorectal cancer, endometrial kidney, leukemia, lungs, melanoma, non-Hodgkin, lymphoma, pancreatic, thyroid, and prostate cancer. What are cancer symptoms and signs? Symptoms and signs of cancer depends on the type of cancer, where it is located, and where the cancer cells have spread. For example, breast cancer may present in the lumps in the breast or as a nipple discharge, change in bowel or bladder habits, a sore throat that does not heal, unusual breathing or discharge, thickening of lumps in the breast or elsewhere, indigestion or difficulty swallowing, obvious change in size, color, shape, or thickness of wax, unexplained loss of weight or loss of appetite, persistent fatigue, nausea or vomiting, unexplained fever, either persistence or come and go, recurring infection which will not clear with usual treatment. Let's take for instance breast cancer. How can one recognize breast cancer symptoms? Over the course of woman's lifetime, she may experience changes. Many end up with nothing to worry about. It is important to have any change you notice checked by the doctor, just to be on the safe side. You need to perform monthly self-exam, attention to breast changes, a medical exam, annual mammogram. You need to start at early age, that is age 40. Well, this video does not replace actual medical advice. Always consult your doctor anytime you observe anything different during your exam. Step 1. Start performing monthly exam as soon as your breast suddenly develops. Check yourself regularly. It is important. You need to know how your breast feel like normally so that you can recognize any changes. Examine yourself 7 to 10 days after your period. If you are no longer having period, choose a date that is easy to remember, such as the first day or the last day of the month. Step 2. Know how your breast feel like. The lumps that is different from the normal breast lumpiness that you have discovered. Any new lumps you discover should be checked by your doctor. Even if you have recently had a mammogram, check the lumps in your armpits too. Cancer lumps are more likely to be hard, painless, and unmovable. Step 3. Look for visible change like damping, puckered, thickened, reddening, scaling, flattening, or indentation of the breast. Step 4. Recognize the nipple change that indicate breast cancer pain. Reddened, scaling, inching, skin thickening, nipple turning inward, discharge other than the breast milk. Step 5. See your doctor about swollen on the part of the breast or breast pain. Swollen or soreness can usually be no cause for alarm, because some symptoms can also be found in inflammatory breast cancer. Step 6. Have your doctor perform breast exam after your checkup, and early begin your mammogram at age 40. If you have family history of the disease, tell your doctor. He may suggest that you start having mammogram at an earlier age. Knowing the signs of breast cancer can be proactive to recognize them early. It is best way to protect yourself. What are the risks and causes of cancer? We have chemical or toxic compound exposure. We have pathogen. We have genetic. We have sunlight. We have cigarettes. We have airstream. We have infection. We have occupational carcinogen. We have obesity, lack of exercise, phone cell low energy, caffeine. How to prevent cancer? Don't use tobacco. Protect your skin from sun. Eat a healthy diet. Maintain a healthy weight and be physically active. Get immunized. HPV and hepatitis vaccine, because some viruses have been lacking to cancer but are preventable through vaccine. Know your family medical history. Exercise regularly. Avoid processed meats. Avoid or drink alcohol in moderation. Continue nourishing yourself from time to time with foha nourisher. Food that can help you to prevent cancer. Food that can help you to prevent cancer. We have broccoli, we have carrots, we have beans, we have berry, we have sycamore, we have nut, we have olive, turmeric, citrus fruit, flax fruit and seed, tomatoes, garlic, fatty fish. How to maintain and treat cancer. Irrespective of the cancer diagnosed, or you have undergone this therapy, surgery, radiation and chemotherapy. Radiation provides extreme to kill each individual cell, and chemotherapy provides chemical that kills each individual cell but they have side effects. And there is a possibility that the cancer cell can still spread to other parts of the body. There is no cause for alarm. For hard drugs are best used along with chemotherapy, and it helps to prevent side effects during chemotherapy. It is able to restrain the growth of cancer. It has noticeable effects on any abnormal growth. It helps to revive the damaged cell and nourish the cell to provide further growth. It also prevents cancer, and it is effective for prostate cancer. Join us every Friday on this channel. It's going to be an educative one. Like and subscribe to this channel so that you can be notified whenever I upload a new video. See you next Friday, my beloved people.